Hi ladies, I'm here to talk to you about cervical cancer. Cervical cancer is the second most common cancer amongst females in South Africa, and in women under the age of 45 is the most common female cancer. Cervical cancer is caused by infection with certain types of human papillomavirus, which is a virus that spreads amongst those of us who are sexually active. Now, it's a real tragedy that approximately 16 South African women die every day from cervical cancer, because this is a cancer that we know the cause of, which is infection with human papillomavirus, and for which we have a number of lab tests that can identify women at risk or women with early cancerous changes, allowing us to manage those women before the cancer even develops. There are two types of tests that can be used to screen women for cervical cancer. The first is a pap smear, which is where a healthcare worker takes a sample from your cervix and the lab looks at the cells under a microscope to look for any changes that may indicate cancer is developing. This test we recommend as a screening tool in women under the age of 25. For women from the age of 25, we recommend HPV screening. This is a test called an HPV PCR, where we look for the infection with HPV from a sample around your cervix. This sample can either be taken in the same way as a pap smear by a healthcare worker, or it can be taken by yourself in the comfort of your own home using a specific self-collection swab. These swabs are available at most Lancet depots and also at a number of participating pharmacies during the month of August. You can take the sample yourself and then deliver it to a Lancet depot or to one of the participating pharmacies. If the HPV test shows that there is HPV present, then you should follow up with your doctor, either your GP or gynecologist, for further management. If the HPV test is negative, then you know you do not have the risk factor for cervical cancer and you do not need to screen again for approximately 3 to 5 years. Don't wait until you have symptoms of cervical cancer. By that time, it's often too late to manage the cancer adequately. Screen before you develop symptoms so that you can pick it up early and prevent yourself from developing cancer. During the month of August, Dis-Chem, Clicks, and TLC pharmacies will be offering discounted testing on pap smears and or HPV testing. Take advantage of this opportunity to test in collaboration with Lancet Laboratories, because we care about our women, and knowing if you have a risk factor for cervical cancer empowers you to do something about it.